Okay, hi, my name is Rachel. I'm going to be doing a head, ear, eye, nose, and throat exam on Caroline, my patient. I've gathered all my appropriate equipment. I've provided privacy, performed hand hygiene. First, I'm just going to observe her general overall appearance. Um, I'm looking at her clothing. Is it weather appropriate? Is her appearance disheveled in any way? Are there any obvious physical abnormalities? I'm also, throughout my assessment, going to be looking at her skin color, doing a thorough skin assessment. I've examined her posture, her mood, her affect, orientation status, and alertness, and her nutritional status. So first part of my assessment is going to start with her head and face. I'm going to be looking for eye contact, level of consciousness, alertness, her orientation status. Next, I'm going to start inspecting the head and scalp, hair distribution. Is there any obvious hair loss, any obvious abnormalities to the shape of her head? It is normocephalic. Next, I am going to palpate the skull for any obvious lumps. I'm looking at the contours of her skull. Any depressions, and there are none. Next, I'm going to inspect her face, that it's symmetrical, that there's no obvious lesions, scarring, deformities, and there are not. Next, I'm going to palpate her temporal artery. Feel the temporal pulse. And then I'm going to move down, palpate the temporal mandibular joint. So I'll have the patient open their mouth, then close, open, and close. And then I'll palpate the frontal and maxillary sinuses. I'll have the patient alert me to any pain they feel with the palpation. Next, I'm going to be doing the eye assessment. So first, I will just inspect eyelashes and eyebrows. There is no crusting, hair distribution is normal, eyes are symmetrical. There's no obvious involuntary eye movement. I'm going to look at her sclera. I want it to be white, no signs of yellow or jaundicing. I'm going to pull down on her lower lash line. Looked at the conjunctiva. It is pink. No signs of discharge. No foreign objects. Next, I'm going to take my light source and look at the lens and the pupil and shine my light obliquely, looking for any foreign objects, looking for any signs of inflammation. Next, I'm going to step back and shine the light directly into the pupils. I'm looking for a symmetrical reflex of the pupils when I do this. Next, I'm going to check her that her pupils are equal and reactive to light. So I will shine a light into her left eye, and that pupil constricts. The second time, her left pupil constricts. So that eye is direct and consensual, reactive to light. In her right eye, the first shine, that one constricts. Second, her left constricts. Now I'm going to test her visual fields. I'll do the confrontation testing first. So I'm going to place my hands on either side of the patient, and I will have the patient alert me when she sees my hands come into her field of vision.
No.
Then I'll move my hands, I'll have them superior and posterior, and do the same.
Yeah. No.
Now I'll test her the 6 cardinal positions of gaze, which tests extraocular muscles. So I'll just have the patient follow my fingers with her gaze. Now I will look for convergence. I'll have the patient follow my fingers as they move towards the bridge of her nose, about 5 centimeters. Then I'll do the near test. I'm going to have the patient look at my light, and then I'll have her look at a object in the distance. I'll look at the light. I'm looking for her pupils to constrict when looking at the object near, and look in the distance. And the pupils dilate while looking at the distant object. So I'd also use a Snellen chart to test vision. You would place the chart at eye level, approximately 20 feet from the patient. And with a card, you'd have them cover one eye at a time during the test. If the patient wears contacts or glasses, you would have them wear those throughout the test. Unless they are reading glasses, you'd have them remove reading glasses. And then you'd have the patient read to the smallest line of letters possible. For the next part of my assessment, I'll be examining the patient's ears. So first I'm just going to inspect the placement of her ears. And then I'm going to just look at the external canal for any obvious signs of drainage, discharge, infection, inflammation. Next I'm going to do the whisper test, which you would occlude one side and then whisper a 2-syllable word and have the patient repeat it back to you. So, sister.
Sister.
Coffee.
Coffee.
Now I'm going to do the tug test. This is where you will pull back on the pinna and have the patient alert you to any pain they might experience with that. That can alert, if they do experience pain, that can alert you to a problem in the ear, infection, some kind. So I'll just pull back on it slightly on both sides. Next, I would take an otoscope, which I do not currently have. And for an adult, you would pull up and back on the pinna, so up and back, and you look into the internal canal, finding the tympanic membrane. You're looking to make sure that it's intact, it's pearly white. For the reflexes, look for the bony prominence of the malleus. For the nose exam, you first inspect. You're looking for symmetry, looking for any obvious abnormalities, physical abnormalities there. Then you'll have the patient flex their neck back. And with your non-dominant hand, you'll pull back on the tip of the nose. And with your otoscope, you'll shine a light to look at the mucosa. Look for any signs of drainage, any signs of inflammation. The mucosa should be pink, pinkish red. And you're also looking for any deviations of the septum. And then you can also do a patency test at this time. So you'll occlude one side and have the patient breathe in. And on the other side as well. For the mouth portion of the assessment, first you'll inspect the outside, looking for any cracking, sores. Next you'll have the patient open their mouth. Take your light source. You're looking first at the mucosa, patient's dentation. Mucosa should be pink. No signs of no open areas, no lesions of any sort. Next, you can have the patient stick out their tongue. Have them say ah to get a better look at the uvula and the tonsils. Her tonsils I would grade as 1+. They're just barely visible. Next, you would don gloves and have the patient open their mouth and assess the mucosa bilaterally, looking for any indurations there. And then you'll have the patient lift their tongue and look at the mucosa underneath the tongue. You could look at the submandibular and sublingual ducts there, looking for any abnormalities there. So for the last part, I'm going to be doing a neck exam. So first I'm just going to inspect. I'm looking to make sure the trachea is midline. There's no obvious masses there. I could also look for jugular vein distension at this time. To truly assess for jugular vein distension, you would have the patient lay supine, remove any pillow from underneath their head, and then you'd have them turn their head away from the side you're examining, and you'd shine a light to see if there's any pulsations or shadows that you might see there. In this case, I see no obvious pulsations. The neck is unremarkable from the outside. Next, I'm going to palpate her lymph nodes. So with the pads of 2 to 3 fingers, I'm going to start with the pre-auricular, and then move to behind the ear to the post-auricular. And I'll move down to the tonsillar, then to the submandibular, and then the submental. I'll do the anterior cervical and the posterior cervical. Move to the supraclavicular, the infraclavicular, and the occipital. So the lymph nodes should be pea-sized. They should be mobile. They should be non-tender. So beforehand, it's best to tell the patient to alert you if they do feel any tenderness with that. You can also, at this time, palpate the carotid artery. Then you want to palpate the trachea. So hers is midline, and I'll just displace it from one side to the other. Next, I want to assess the thyroid, which I'll do from behind the patient. With both hands, I'll find right below the cricoid cartilage, I'll find the patient's thyroid gland. I'll have the patient swallow. Should be able to feel the isthmus of the thyroid move up and down. Here I'm looking for any lumps, any tenderness, inspecting for any goiters or nodules. I'll also look at the patient's range of motion of their neck and muscle strength during this assessment. And that concludes my head, ear, eyes, nose, and throat assessment.